Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring another in our series of interviews with top leaders in health IT. And our guest today is Jeff Burrow. He's National Healthcare Director at Pocketalk, and Matt Fidler, Director of Patient Experience at Augusta Health. Welcome, guys.
Happy to be here.
Thank you. Thank you, John. Thanks for having us. Appreciate it.
Yeah, excited for the discussion. Lots to talk about. Before we dive into today's topic, Jeff, why don't you kick us off? Tell us about yourself and Pocketalk.
Sure. I have a 25-year background in consumer electronics, and then I was introduced to Pocketalk. It's something I could not pass up. My wife works at a children's hospital. My daughter is about to graduate from nursing school, and she's already been offered a job. Yay.
Wow.
So we are a healthcare family of robust discussions about it in the evenings. I love what we do. I love Pocketalk, how it's inclusive and brings people together. It's kind of how we work together, and I'm happy to be here. Thank you.
Awesome. And Matt, I'd love to hear about yourself in Augusta Health.
Absolutely. So my background's in clinical counseling psychology, and I've been doing patient experience work for the last 12 years. Been at Augusta Health for about six. So, and we just started a partnership with Pocketalk back in March, and I think we're here to talk about that journey.
That's awesome. Well, I never thought I'd have a clinical psychologist on here. That's awesome, but it makes sense from a patient experience perspective. I'm excited to learn from you. But let's dive in. Jeff, tell us, what is Pocketalk?
Pocketalk, very simply, is an audio and text translation device that's highly secure. It's HIPAA compliant, ISO certified, all those good things. That translates in 92 different languages. So it can be used pretty much anywhere in a hospital or healthcare setting. There's not a lot of time when you need a translation quickly and you need it accurately. And it looks like this.
Wow. I mean, it's such an important thing, right? I mean, it's literally a legal requirement to provide translation services in healthcare. So it makes sense that you'd offer this. What would you say are some of Pocketalk's kind of key features that a healthcare organization could use?
The device itself, as you can see, it's very simple. It's one language to another. There's an arrow to tell you the direction of the translation. You can tap that arrow to go towards English or from English to another language. Right now, I have this going from English into Vietnamese, but I simply press this button and begin speaking, and I can speak as fast or as slow as I want. There is a microphone on either end of the device, so it'll pick up, even from across the room, what's being said. I release the button, and just like that, it will translate it.
Và bắt đầu nói. Tôi có thể nói nhanh hoặc chậm tùy thích. Tùy.
You can also see at the top of the screen, there's a small gray bar. You tap that, it gives you the translation history. The reason it's up there is to stay hidden so nobody can look over your shoulder and see what's been said for purposes of security. But once you get to that point, you could tap the screen and replay what's just been said.
Và bắt đầu nói. Tôi có thể nói nhanh.
Or you can hit reverse translation and it will take that translation, send it all the way back through the system back to you. The reason you would do that is if you asked a question and somebody looked at you kind of confusedly and you weren't sure that the translation was coming across the way you intended, there is a way for you to self-check that. If you hit reverse translation and it comes back to you, sounding like what you said, you can be very positive that what you conveyed was accurate. We also have a camera, the very top corner. The camera can be used for all kinds of different things, but the use cases I'm primarily hearing from the healthcare field are for vaccination, forms, and for discharge papers, for instructions, follow-up instructions, things of that nature. But if you take a picture, it can translate from their language into yours. And conversely, if there's something you would like conveyed to them, you can take a picture of it. They can then read and hear it. If literacy is an issue, you can tap the screen. It will read aloud what's on the page to them so they can understand what's being said. There's 92 different languages to choose from. You simply tap the language. It will give you a list, both recent and the full list. You can also select a language by hitting the microphone button and speaking the language you would prefer to translate into. But overall, it's very simple to use. It takes no more than 10, 15 minutes to learn how to operate a Pocketalk device.
Awesome.
One of my
Uh,
favorite things about it, I am pretty good with Spanish, but if I heard Spanish and Portuguese spoken, I might have a difficult time discerning, which one's being spoken right now. There's actually a flag option on the Pocketalk device where if you weren't sure what language they were speaking, you can pull up the flags and they can actually point to their country. And then it's going to load every available language for that country. And then it's just process of elimination and getting down to where you need to be. Uh, that and I love it for any translation you do, whether you're using the camera or if you're using the microphone, it puts the translation up on the screen that's easy to read. So if you have a patient that's hard of hearing, this could be a godsend to them because you may not be relying on the verbal translation coming through. They can just read it.
Interesting. Matt, talk to us about what it was like, to, roll out Pocketalk to Augusta Health. How are you using it? Where are you seeing it leveraged in your organization?
Absolutely. Well, if you look at where we were before, we were no different than any other healthcare organization out there. We had in-person interpreters, and then we had the virtual interpreters that would come in for primarily provider encounters. So let me give you an example. If we had someone come into our medical office building, it is a 3-floor medical office suite. We have someone that is Spanish speaking and they're due to be up on the 3rd floor to meet with their provider. Interpreters waiting for them in the room. No one ever thought of, well, what happens? How do you get them from point A to point B? When they walk in the door, are they going to instinctively know to go up to the 3rd floor? We hadn't ever really broached that question. So what we were experiencing were patients coming into the main lobby in the medical office building confused. They don't know where to go. They don't speak English. And that leads to a lot of frustration. So we have to call over to the nursing supervisor, get an iPad delivered, get the interpreter on the line, only to find out that they're just here for an appointment. So that and wayfinding has been a struggle, I think, for everyone out there. So when we were first thinking about leveraging Pocketalk, we were like, so let's just launch it at our entrances. That's our hot spots right now. That's where we're experiencing these people coming in. And it's not so much about convenience for us, it's about easing the burden of seeking out healthcare for someone that doesn't speak the language of the area. So that's where we started. But the longer we've been with it, the more we keep thinking, yeah, we didn't think about health informatics. When someone's requesting their medical record, what do they do if they don't speak English? How can we now leverage that technology with that unit? So we started with 5, and now we have 43. So we keep thinking about new places to have it. Any of these entry points where anyone can come into our system, we want to make sure that we have these tools available and we're not having to leverage these highly trained medical interpreters for wayfinding.
That's really interesting, right?
Yeah, I could say from our side, my only concern was how often was the device or app going to get used. So we knew there was a need. We knew there was a lot of untranslated conversations that needed to happen that weren't, which is a liability. So, I mean, you're only able to cover so much. And when we came into Augusta Health, just a handful of devices, they used it, over 11,000 times in 3 months. And Augusta came back and said, well, first of all, we need more. And secondly, we did not realize how many untranslated conversations needed to happen. We did not, in order for patient equity to truly occur, the patient has to feel like, okay, I'm being treated the same as everybody else, and I have the same opportunities to communicate my health needs as anybody else does and be comfortable doing so.
Absolutely. And let me give you another example. In the inpatient tower, let's say we were using a medical interpreter for relaying test results and everything. What we were experiencing was that everyone was bundling care during that time that we had that interpreter in there. That's when they were going into the room. That's when they were really checking on the patient. That's when they were trying to get everything they needed done while they had that interpreter on the line. Much of that conversation did not need to be run through the medical interpreter. It's that human connection piece. Now we have a device where anybody can just pick it up, walk into the room and ask, are you comfortable? Is there anything I can do for you? Can I get you a blanket? Can I get you some coffee? The things we don't need a medical interpreter for, but we've always had the leverage in the past for. So.
It's
That's so
not uncommon. I've
fascinating.
been to a lot of different conferences and the same story happens over and over. I'm a nurse. I have 4 patients. One of them does not speak English. I have to arrange my entire shift around that particular patient, bring on a language line or interpreter service.
Yeah. What an amazing story. I mean, I've been covering this for 20 years, heard all about language translation. Even when I implemented EMRs, we had language translation calls, etc., right? But I've never once heard it at the initial point of care or wayfinding. I've always heard it in the exam room with the doctor and the nurse. That's so fascinating that it's not more pervasive, because you're right. If you only speak Spanish and you walk into the exam, into the hospital and you're looking where to go, you're already having a bad experience from the get-go. Wow, that is so fascinating. So tell us more, Matt, like over the phone translation services with human translators, they've been around for forever. As I mentioned, I implemented them 20 years ago and was leveraging them, in organizations I worked at. How has Pocketalk kind of impacted your use of those services? Have you replaced it completely, or is it really these other forms of usage that are more popular in your organization, and you still need a human translator for certain things?
Yeah. So, I mean, due to regulatory compliance, they're not going to go away. There's still going to be those situations where you have to use them. As good as the technology is, the laws haven't caught up to it. I can tell you right now, we have put Pocketalk through its paces. Any opportunity I can to speak with someone that knows English and another language, I'm testing them. I'm having them play around with the device. I want to know how accurate it is, because from my experience, it's as accurate as you can get. Um, where I think the impact is these non-clinical needs, right? So the wayfinding, the just human connection piece at the bedside, the things where you don't necessarily need someone that's trained in medical interpretation. You don't need the accuracy. It's truly just finding out another way to connect with someone. That's the bread and butter of this one. I think of how many times in the past we've utilized a medical interpreter when we didn't actually need one. But it was the only resource that they had available to them. This is human connection in a device. For instance, if you have a patient that maybe speaks a little bit of English but primarily French, right? We would have the option of going in and just asking, like, what do you most prefer? Like, how would you like to communicate with us if the stars aligned and we could speak your language? I think you'd be hard pressed to find anyone that would say, well, let me struggle with my second language that I'm maybe not as confident with, and maybe I can't get everything I need out. They're going to lean on their native tongue. And this enables our clinical team of going in there and connecting with them at that level.
Yeah, you're right. I once did an interview in Italian and I was like, wow, it would be so much easier in English. Because you're right, the native just is naturally easier, even though I speak Italian, right? Like, there's a burden that comes from speaking a second language. That's fascinating. Jeff, is this a common kind of experience with the customers you're working with, where they're kind of leveraging it similar to Augusta Health? And tell us more about kind of the Pocketalk business model with hospitals. It's interesting that you have your own device, but you can work with other devices. Tell us more about the business model that you offer.
Sure. So the device is secure, standalone, GDPR, HIPAA compliant, all those good things. And, if it's non-clinical, why does it have to be HIPAA compliant? The reason it has to be is because you never know when a conversation is going to turn towards a plan of care or to a complex medical discussion.
Sure.
Or the devices and apps are being used in the ED quite a bit. We're hearing more and more feedback about the uses there. When there's not time, you are allowed to use machine translation. And that quite often is the case in the ED. I think Crystal Farmer mentioned that it saves 3 to 4 minutes in the ED, which that's a lot of time in the emergency room. So, but we have the device itself, but we also have an app. As I said, it can be used on a Zebra device or existing device. In addition to that, we have something called Ventana, and that is a software program, multi-device management tool or console. And that allows you to control the connectivity and control the security of all the devices in the hospital. So you could group them say these 10 devices, I want you to delete your translation history every 10 minutes. These devices here are in a highly secure area. I want the camera disabled so that nothing can be, no pictures can be taken. But it will also capture date and timestamp translations. So when the need arises for charting and documenting, nurse can go in, take a look at it, export that information, and then drop it into a patient's EHR.
Interesting. Yeah, I love that you're focused on the security aspects and also, being able to access the transcripts. That's really interesting. I think a lot of people listening are probably like, well, I traveled to another country. I use Google Translate. Like, how is this different from Google Translate? Because it kind of sounds like the interface is pretty similar.
Okay, yes, I get this a lot. So, first of all, I've had friends ask me, "Hey, I'm going to another country. Give me one of your devices." And my response to that is, you're probably just going to be reading menus, and you know what? You're not going to say anything that needs that level of security or accuracy. Just get a free app or something. That's fine. But Google Translate is not secure. It's not as accurate. Pocketalk has everything we do comes from the basis of security. Even the screen itself is designed so that when something is spoken, nobody can look over our shoulder and see what's been said. The translation history has been hidden. But anything spoken into one of these devices, once it hits our engine, Prism Language Solutions is the brain that we use to derive such accuracy and security. Once it hits that, it's gone. A court could come back and say, we want everything that was said into this device, but it doesn't exist anymore. Unless you choose to keep it, it doesn't exist. So it's accuracy, it's speed, but most of all, it's security.
Interesting. Yeah, it's a little more complicated than a menu. Clinical talk is a different beast altogether, that's for sure.
We do have a very good medical glossary. I will say I sat one night looking online through as many medical terms as I could for like 3 hours, and it got most of them. So, I mean, when the need arises, it can absolutely translate high levels of medical jargon. If it gets too high, perhaps you need to think about how you speak to a patient, so it's not too complex. But it does fine.
That's awesome. So Matt, talk to us about it. Like, how has this impacted your patients? How are patients responding to the, fact that you have these devices?
Anecdotally, anytime that we have a patient come into any of our main entrances, whether it's the atrium or our medical office building main entrance, the security team is very vocal. Security volunteers, the people that man these front doors, they just let me know, hey, here's someone we were able to help today. Oh my God, thank you so much for having this here. This isn't going away, right? I'm pretty sure if I were to go to the doors right now and say, hey, we can't keep this up. I'm sorry, we're gonna have to take them back. There will be torches and pitchforks. I would have to relocate my office. It's impacted their days. Now they feel more comfortable when that situation does arise. They know that they have the tools to meet them where they're at. Um, I thought the volunteer core was going to be the hardest. They were going to be like my hurdle, right? How am I going to teach them new technology for them to leverage with patients as they come in? And to Jeff's point, it was maybe 10 minutes with them. It helps only having 4 total buttons on the device itself, with that main Pocketalk button being the big one. All of them took to it like a duck to water. Data wise, I'm able to drill down to patients that primarily speak Spanish. I can see individual survey results. I know the kind of impact we're seeing at the clinic and hospital level. And I can tell you, for those that identify being primarily Spanish speaking, because if you look at our Ventana account, like 80% of the translations we've done out of the 20,000 translations we've done have primarily been Spanish. When you look at their data, we've seen a growth of 15 points from before we started to where we are now. And the only thing that we've changed for these visits, for this patient population, is having one more tool in our toolbox to meet them where they're at and get them to their appointment. So we're looking at communication, we're looking at the overall, we're looking at the would recommend, and in every single one of our domains, we've seen an increase of 15 points.
That's amazing. I mean, from the patient
Spectacular.
perspective, you know, they get to experience healthcare the way they deserve, you know, and that's true whether they're Spanish speaking, which is that I love that you have the specific Spanish speaking because that's such a dominant thing in so many areas of the country. But also if you speak some Swahili or you know some more obscure
Right.
language, which you know many human translators aren't
Swahili's in
comfortable.
there.
That's awesome. Very cool. You know, Jeff, what's next for Pocketalk and kind of for healthcare translation? You know, what else where are you looking to take this next?
We are, well, first of all, we are international. We have a partnership with Zebra Technologies, and that's launching in France and Germany right now. I just came back from a Zebra event not too long ago. They are extremely enthusiastic about it. We have Ventana, and which we are learning more and more about all the time. So when Matt's talking about reviewing the different languages, we're hearing back more and more that it's also being used as a language trending analysis. So instead of, wow, it seems like there's more and more people speaking Korean, or it seems like we've had more and more patients who speak Vietnamese, you'll know real time. So you don't have to go figure out a survey. If you have a representative sample of devices in the field or in your system, then you'll have a great idea how often which languages are being spoken, which ones are coming on more, and perhaps we should print collateral material out for them. So we're finding more and more use cases for this as this goes along. Thanks to Matt for finding even more. I've heard over the past few months, there's parking lot attendants using them. There's gift shop employees that are using them. There's their own employees that are using them. The use cases are tremendous. Patient transport, that's a strong one. Environmental services, they come in contact with the patient a lot more than you might think. Food service, how often are they in front of the patient? In fact, I'll just tell a little story. I was at an event last year, and the first person to come up to us, he said, "Hey, I'm in trouble. I need help. We got dinged by the Joint Commission." And so what happened? He said, "Well, my food server spoke Spanish, my nurse spoke English, and the patient spoke Russian. And right in front of them, the three of them could not figure out this patient's dietary restrictions." So there's so many use cases that keep popping up, and we keep finding new, better ways to utilize Pocketalk. So we look forward to that journey. We're just now getting started. This is a wide open field. Nobody's doing this that I know of but us right now. So we see a very bright future.
Very cool. Jeff, Matt, I love this. I love that you're making healthcare more accessible to the patients and in the language that they can understand. I mean, the studies are clear that if you have the right language translation, then care improves, the experience improves for patients. So I love that you're taking it even to that next level to improve the experience and accessibility for all your patients. So thanks so much for taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, guys.
Thanks,
Thank you.
John. Thanks, Matt.